North Shore is one of the oldest and most established integrated medicine programs. That is, they started and they have lasted due to a number of factors.
We are a large team. We have a lot of great people on the team, but creative people with great, brilliant ideas.
The integrative medicine department is part of the hierarchy of the hospital, just like pulmonary department, respiratory therapy department, cardiovascular surgery. We are the integrative medicine department of NorthShore University HealthSystem.
Think about the conditions that have a lot of chronicity and that are tough to treat, that if Western medicine has failed, people throw their arms up, they don't know what else to do. A lot of times they will turn to us if they know about us.
Patients who are coming in, maybe we've heard of it through a friend or on Oprah or whatever, but they're still a little nervous. This is outside their boundaries, and so but they want to try. So it's a lot of education, not just with the patients, but then you take it the next level. We're trying to educate the medical interns coming in. We're trying to educate the docs that what we're doing is safe, effective, over and over and over again.
We are always very cognizant of doing professional education, making sure whenever the doctors need education, we're there to provide it for them.
I started off as an undergrad at the University of California, Berkeley, so that already got me on a different track, and I became interested in medicine later on in my undergraduate career. I decided to cram all of my pre-med classes in my junior and senior year, and so I came to this decision late. I decided that I wanted to be a doctor no matter what, no matter where, and I applied all over the place. I got into the University of Santo Tomas in Manila, Philippines, and I said, I'm going there. My aunt went there. She came back. She was a professor at USC, and she's doing fine. So I thought, okay, I'll go there. It's a lot cheaper. How hard could it be? And it turned out to be the greatest experience I've ever had. And when I went to medical school there, it opened my eyes as to how I became, or why my parents were the way they are, why they were so strict with me, but also the cultural traditions that came out of being Filipino. And when I went through medical school there, with the physical hardships and the uncomfortable circumstances of hot weather, humidity, whatnot, I saw people using other ways to heal other than what I had to offer as, offering traditional allopathic medicine, which was how it is there in the Philippines. They use Western medicine and they value it a lot, but it definitely is a medicine of the wealthy still. So if you don't have the means, people will make do with folk medicine, herbs, spirituality, you name it. They were trying every remedy, safe or unsafe, and I got to see a lot of that. Contrasting that, when I came back to the United States to do my family medicine residency at Northwestern University, it was a total flip to go to the North Shore of Chicago, where we had all the cutting edge technology, all the supplies we ever needed. It really was quite a transition, and I felt like there's something in the middle. There's something in the middle here where I've seen a developing nation struggling with their health care, keeping their people healthy to a point, yet coming over to the States and just seeing, just fast forward to medical technology and all of that. And I really thought, wow, what a unique way to do medicine, to blend what I've seen there and what I know I can do here, and hopefully create the most holistic, well-rounded health plan for my patients. So I got interested in the University of Arizona's integrative medicine program and studied with Dr. Weil, and 2 years later, here I am. I look at myself as the team leader for this very diverse, strong group of integrative medicine practitioners, sort of the lead physician, looking at all the different players, even outside of our team, outside of acupuncture and body work and counseling. I also look at the allopathic, conventional side, like medications, what procedures are necessary, what diagnostic tests need to be run, And with that knowledge, I combine as much as I can for each patient what I feel is the most appropriate.
One of the other significant, unique things that's occurred in the last year was that we have now been approved for hospital privileges. So not only do we practice in our primary site, seeing, again, between 500 and 600 patients a month at our outpatient clinic, but we have now been granted privileges to provide acupuncture within the hospitals.
I have patients tell me, I'm coming to you over another acupuncturist because I know that you're with the hospital, I know that you can see my charts, and we're all within this system, and they feel a little more secure with that. So I feel like the access is pretty amazing.
You know, if I see a string of patients that really need some kind of program or a class where they can meet other people and just laugh, for instance, I'll say, you know, I heard about laughter yoga. I think that's really neat. Let's train one of the practitioners and let's offer a class.
We get constant referrals from doctors within the medical group at the hospital, and that's due to Dr. Mendoza's marketing. So the cost of doing business for a practitioner working in an integrative setting, at least at NorthShore, the cost of doing business for us is minimal.
We get our referrals from within the system. We get them definitely from the community, people looking on the web, trying to find an integrative physician or practice. One of my jobs is to really get into our system and make sure that the departments know that we're here and that we can help you, partner with you in treating your patients.
Well, one of the first things, if you are interested in working in an integrated model such as NorthShore's, the first thing to do would be do some research as far as what current institutions offer integrated programs. What current institutions offer TCM or Oriental medicine within their walls. So find out if there's any programs available in the area. The next step would be to contact them and see if they're open to providing you an internship there. And usually that's what I did, and I was able to intern at least 3 sites. Institutional sites, by offering my services or just asking to observe, just whether it was a day, 2 days, a half a semester, usually for no pay, no credit, but the observation and the experience and the knowledge you gain from that is invaluable.
The big challenges are I think the Chinese herbology. There's not enough known how it can combine with allopathic medicines. I know there's a lot going on in the Chinese medicine journals, but there really isn't enough for me to see, to feel comfortable that, hey, we can use Chinese herbs without, with no restriction. Other challenges will be the way the system values and understands these therapies that they've not really seen before. Trying to get administration to understand that a lot of the treatments that we provide are very relational and time intensive, and to not fall into the trap of, okay, well, let's now crank out double your production of patients so that you can see 20 clients instead of 10. You're going to lose quality there. You're going to see a lot more people, but the relationship that one builds with your patient takes time. And to not feel rushed, and that's what I'm hoping doesn't happen. For most people, it's 15 minutes, 20 minutes, even less, then you're out the door with half your questions answered. So I don't want that happening to traditional Chinese medicine. Body work, either, of course. So that's a challenge. Also getting the administration in general to understand just how the workflow is with respect to being able to do acupuncture on one person and needing more rooms. So the space issue, we've run into issues where they think we just want or need 1 room, but actually we could use 2 or 3 so we can see more patients and be more productive, and battling for space when the therapies we provide are not as revenue generating as someone who's getting a chemotherapy treatment. So the hospitals, they look at the dollars and cents. And it's something that you have to really want in your heart to pursue, because the rewards are great, but it doesn't always end up as change in your pocket.